Missouri Attorney General Andrew Bailey on Thursday unveiled details of an emergency rule aimed at making it harder for trans children and adults to access certain medical procedures, calling them experimental, and arguing that they need significant railing. Once submitted to the Minister of Foreign Affairs, the rule will be valid from April 27 to February 6, 2024. Citing the Missouri Trade Practices Act, a law aimed at prosecuting ulent business practices, Bailey's office envisioned a multifaceted disclosure and screening process for doctors offering gender-affirming care. The Attorney General's rule requires that anyone who has undergone anti-puberty drugs, intersex hormones, or gender transition surgery first receive 15-hour sessions with a psychologist or psychiatrist for at least 18 months. The rules also include a provision that prevents doctors from prescribing adolescent blockers or cross-sex hormones if a patient does not have the latest, consecutive 3 years, medical documentation showing gender dysphoria. Otherwise, healthcare providers in Missouri who have been prescribing drugs for years without a certificate could be sued by the Attorney General for alleged. In a press release on Thursday, Bailey said, "I will always fight to protect children because gender transition interventions are experimental." Shira Berkowitz, Senior Director of Public Policy and Advocacy at LGBTQ advocacy organization Promo, said Bailey's office stated that they know better than not only all major medical professional associations, but also all practitioners who follow these guidelines and care for patients. Critics of the proposed rule, including Lambda Legal and the Missouri American Civil Liberties Union, have already pledged to sue. Tony Rothert, Director of Integrated Advocacy at Missouri ACLU, told Independent that this provision exceeds scope of Missouri Trade Practices Act. He said the law was used to try to stop that typically benefits Missouri citizens. Determining what patients should do to get rid of this mental health concern is getting into medical practice, Rothert said. It's trying to fit everyone into one box, and medicine isn't practiced that way, and the law doesn't regulate medicine that way traditionally, he said. Minutes after Bailey announced language of emergency rule, House Minority Leader Crystal Quade accused Attorney General of trying to create legislation through rules process. These doctors are already doing exactly what they should be doing and what every standard of care in every medical association in our country tells them to do. That is what they do. It's really fascinating that our Attorney General thinks he's a legislator and can tell doctors how to do their jobs better. Bailey's emergency rule was issued same day that Missouri House approved a version of the law that would prohibit patients under age of 18 from accessing gender-affirming care.